What are the contraindications for sodium nitroprusside? Have you ever wondered when sodium nitroprusside should not be used? This powerful medication is often a go-to for managing hypertensive crises, but there are specific situations where it is not recommended. Let's break down the key contraindications to keep in mind. First, sodium nitroprusside is not suitable for patients with compensatory hypertension. This occurs when high blood pressure is a response to structural cardiovascular issues, like arteriovenous shunts or aortic coarctation. Lowering blood pressure too quickly in these cases could worsen blood flow to vital organs. Next, if someone has inadequate cerebral circulation, sodium nitroprusside should be avoided. This is particularly important during surgeries where controlled hypotension is needed. Reducing blood pressure in these patients can lead to serious complications like cerebral ischemia or even stroke. Another critical group to consider is moribund patients undergoing emergency surgery. These individuals are classified as American Society of Anesthesiologists Class 5E, meaning they are not expected to survive without the operation. Using sodium nitroprusside in these cases can lead to severe hypotension and jeopardize vital organ function. Certain rare conditions also pose a risk when using sodium nitroprusside. For instance, patients with congenital optic atrophy, known as Leber's, or tobacco amblyopia should not receive this medication. These conditions can impair the detoxification of cyanide, which sodium nitroprusside can releases during metabolism, leading to toxic accumulation. Acute heart failure with reduced peripheral vascular resistance is another contraindication. In cases of acute congestive heart failure, especially high-output heart failure seen in endotoxic sepsis, sodium nitroprusside can worsen hemodynamics due to further vasodilation. Additionally, if a patient is taking phosphodiesterase type 5 inhibitors like sildenafil, tadalafil, or vardenafil, sodium nitroprusside should not be used. The combination can result in dangerously low blood pressure. Lastly, any known hypersensitivity to sodium nitroprusside or its components is an absolute no-go. It is also important to exercise caution in patients with liver issues or those at risk for increased intracranial pressure, as sodium nitroprusside can worsen these conditions. In managing hypertensive crises, understanding these contraindications is essential. Proper patient selection and ongoing monitoring can help avoid complications and ensure safe treatment.